An alarming number of pet owners are hesitant to get their dogs vaccinated. A look inside one of the 20 mobile stroke units in the country. And 22 years later, the number of FDNY members who have died from 9/11 related illnesses now matches the number who died on that tragic day. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Michael George. We begin with a new report on COVID-19. The CDC says nearly 18 million Americans experienced long COVID in 2022, and nearly 9 million people currently have the condition. Adults 35 to 49 are most likely to report having long COVID, and women more likely than men. The condition occurs when patients have symptoms at least 4 weeks after they cleared the infection. In some cases, symptoms can be experienced for months or years. Those include fatigue, difficulty breathing, headaches or brain fog, joint and muscle pain, and continued loss of taste and smell. Now, if you think you have COVID, but those old test kits are expired, don't throw them out just yet. The FDA extended the expiration dates for a number of different brands, lengthening their shelf lives to up to 2 years. But if you're out of tests, there's good news. The federal government is giving some out for free once again. And as we're hearing from medical experts, now is the time to stock up, as well as get the latest vaccine. Ahead of an expected winter surge of COVID-19, the White House has turned covidtest.gov back on, allowing Americans to have 4 free test kits delivered to their door. CBS News medical contributor Dr. Celine Gounder says the tests will help keep the most vulnerable safe throughout the holiday season. The late summer surge has slowed for now. New data from the CDC shows there were 19,000 hospitalizations in the week ending September 16th. That's down 4% from the previous week. Ada Chang says she's getting the vaccine to protect those around her. There are some reports that people with insurance are being charged for the vaccine. Dr. Gounder says it's a billing issue still being ironed out, and people may just need to submit their bill to their insurance company for a reimbursement. CDC data shows flu vaccines reduced hospitalizations and deaths among adults by nearly half last year, and by 3/4 among children. But many Americans say they may not get the flu shot. Bradley Blackburn spoke with top health officials about their concerns.
With COVID-19, flu, and RSV circulating in the coming weeks and months, top public health experts are spreading the word. Vaccines are safe, effective, and protect against serious illness. Dr. Mandy Cohen is the director of the CDC.
Maybe a little fever.
A new survey from the National Foundation for Infectious Diseases shows while 65% of adults know vaccination is the best way to prevent flu hospitalizations and deaths, 43% do not plan to or are not sure they will get vaccinated. Last flu season was moderately severe. Activity levels returned to pre-pandemic levels. There were 31 million illnesses, 360,000 hospitalizations, and 21,000 deaths. 176 pediatric deaths were also associated with flu, the third largest number since reporting began nearly 20 years ago. The CDC reminds that receiving multiple vaccines at one time is safe and effective, giving you multiple shots at protection. Bradley Blackburn, CBS News, New York.
More than 1 million Americans are allergic to sesame. At the start of this year, sesame was added as the 9th major food allergen, joining the likes of milk, peanuts, eggs, shellfish, and other foods. This addition requires food manufacturers to clearly label if their product has sesame. The hope was that it would make it easier for those allergic to identify foods they can't eat. However, the FDA says companies began unnecessarily adding sesame to their products rather than going through the effort to prevent contamination. In hopes of reversing that trend, the agency updated its food safety guidelines, offering information about how to establish and implement a food allergen program. The FDA can't mandate companies to follow the guidelines, but are encouraging them to do so. This was the hottest summer on record, according to NASA scientists. June, July, and August were a combined 0.41 degrees warmer than any summer going back to 1880, when record-keeping began. In the U.S., Phoenix saw 31 straight days of high temperatures above 110 degrees. Arizona's Maricopa County reported more than 280 heat-related deaths this year, and more than 200 others are under investigation. Emergency room doctor Frank Lavecchio has been overwhelmed by patients. And even though the cooler fall temperatures may be here for much of the country, national and international climate groups say September has been warmer than the historical averages. Flesh-eating bacteria infections are on the rise in the U.S. The Centers for Disease Control and Prevention recently issued an advisory alerting doctors and public health officials to be on the lookout for cases that can cause serious and even deadly infections. For more on why the CDC issued this alert and tips to avoid flesh-eating bacteria, I spoke with Dr. Bill Sullivan, a microbiologist with the Indiana University School of Medicine. Dr. Sullivan, thanks so much for joining us. I want to ask about, first off, even the term flesh-eating bacteria. It sounds pretty alarming. What are we talking about when we refer to these infections?
Right. We don't want to start any panics, even
Right.
though it is a very terrifying name. Most people are probably going to be okay as they enjoy their time in the ocean and so on. But we do want to make sure that those who are vulnerable, most vulnerable to this infection, are protected and keep an eye on any injury that might occur while you're engaged in swimming or fishing or even preparing seafood.
Let's talk about that. How do you catch this particular infection?
Flesh-eating bacteria are caused by a number of different types of bacteria. So strep A is one of the groups that primarily causes most of the infections, but the CDC issued an alert in September about an additional culprit called Vibrio vulnificus.
Doctor, do we know why we're seeing more cases of Vibrio vulnificus?
The primary driver of the increase in Vibrio vulnificus is linked to climate change. A study published just this year found that Vibrio vulnificus cases have increased 8 times over the past 3 decades along the east coast of the United States. There are some areas that have never seen this bacteria in their waters before, and cases have been reported as far north as New York and Connecticut, all linked to the warmer ocean temperatures that this bacteria needs to thrive.
And what kind of symptoms does a patient typically have? Does this actually eat flesh?
When we refer to flesh-eating bacteria, it's not just a superficial wound on the skin. Once these bacteria settle into the wound, they grow rapidly and release toxins that destroy the underlying tissue. That includes the destruction of muscle, nerves, and blood vessels, the latter of which is particularly important since this bacteria has to be treated with antibiotics. When it destroys the blood vessels, those drugs can't get to the site of injury, making it very difficult to treat this infection.
It sounds pretty painful and pretty debilitating.
The early symptoms include severe pain and swelling at site of injury. And if that is accompanied by fever, the victim needs to seek medical attention immediately because time is of the essence in order to minimize the spread of infection.
All right, some very important information. Doctor, thanks so much for joining us. We appreciate it.
You're very welcome. Thanks for having me on.
The New York City Fire Department reached a grim milestone. Shortly after the 22nd anniversary of the September 11th attacks, FDNY union leaders say 343 firefighters and other personnel have now died from 9/11 related illnesses, the same number lost on that tragic day in 2001. Union officials are asking for more funding from the federal government to treat the sick. They say the department averages 3 or 4 deaths a month. The U.S. Preventive Services Task Force is recommending screening for hypertension disorders throughout pregnancy, even in people without chronic hypertension. The report from the independent panel of medical experts recommends doctors check blood pressure to monitor for related disorders like preeclampsia. Incidence of hypertension disorders in pregnant women increased from about 13% in 2017 to 16% in 2019, impacting at least 1 in 7 deliveries. About 1/3 of women who died during a hospital delivery had been diagnosed with the condition. Jessica Shepard is an obstetrician and chief medical officer for Very Well Health, an online wellness resource. Risk factors for maternal hypertension include being above 40 years old, obesity, and diabetes. Having a stressful job can take a toll on your heart health, even more so if you're a man. That's according to a study in a peer-reviewed journal of the American Heart Association. Researchers found job-related stress combined with getting little reward at work nearly doubled the risk of heart disease in men. Dr. Sue Varma is a board-certified psychiatrist and a clinical assistant professor at NYU. She says coworkers can make a big difference. Varma also notes that getting at least 6 hours of quality sleep can improve a person's health. Coming up, a possible link between tear gas and reproductive health. And several states have expanded dental coverage through Medicaid. We'll tell you which ones. Welcome back. The anti-vax movement that's gained steam in the last few years apparently doesn't just stop with people. A new study finds many dog owners are skeptical of having their pet vaccinated, even though that puts the animal and their humans at risk. Danya Backus has details.
Sin Jin Chun is confident his dog Kobe is safe as he plays with other pets on this Southern California beach. That's because Kobe's had his shots. A study from Boston University School of Public Health found Kobe may be in the minority. 53% of dog owners have some hesitancy toward canine vaccines, seeing them as unsafe, ineffective, or unnecessary. Dr. Matt Mata says an unvaccinated pet is a danger not just to other animals, but also to the humans around them. Almost all states require rabies vaccinations, and there are several other shots that veterinarians recommend for dogs. The study also found vaccine misinformation has been projected onto pets as well. There is no evidence vaccines cause autism in humans or animals. Danya Backus, CBS News, Los Angeles.
Some people don't go to the dentist because it's an unpleasant experience. Others are just flat out scared. But for some, it's because they can't afford it. Only about half of all states offer extensive dental care through Medicaid, according to the Centers for Medicare and Medicaid Services. But this year, 6 states began or expanded their programs, offering patients significant discounts. In Tennessee, Dr. Ryan O'Neill says his practice has been overwhelmed since opting in. O'Neill is hoping to hire more dentists to keep up, but says it can be months to get one certified under Medicaid. Tear gas was a common tactic used by police during the George Floyd protests in 2020. Now a new study says there may be a connection between the chemicals used and reproductive health. Kirsten Mitchell spoke with the expert making the connection.
After exposure to tear gas during protests in the summer of 2020, some noticed changes in their menstrual cycles and reproductive health.
That to me was where I really had questions because that usually doesn't happen.
So Asha Hassan and researchers from the U of M and Planned Parenthood surveyed people across the country.
Anyone who was an adult who had been exposed to tear gas during that time period and who had a uterus was eligible to participate in this study.
Of the more than 1,200 participants, 83% reported adverse reproductive health outcomes. The top changes were cramping and early menstrual bleeding. Those with 5 or more days of exposure experienced 2.6 times more negative reproductive outcomes.
This is really something that's exploratory and allows us to say, yes, there's a relationship here between being exposed to tear gas and having these adverse reproductive health outcomes.
The study has limitations and does not prove a cause and effect.
I think it's important also to note that this is a snapshot in time.
But Hassan hopes it fuels further research in an area that's lacking.
This sort of data is really just the first step.
Kirsten Mitchell, CBS News, Minneapolis.
According to the Washington Post, food companies and industry groups are paying dozens of registered dietitians to share information on their social media channels that's counter to the scientific evidence about healthy eating. One campaign specifically targeted the artificial sweetener aspartame, which the World Health Organization labeled a possible carcinogen earlier this year. Marlene Schwartz is the director of the Rudd Center for Food Policy and Health and a professor of human development and family sciences at the University of Connecticut. Schwartz notes there is an FTC policy that requires influencers to disclose when something is paid content, but they sometimes make that as subtle as possible. After the break, how surgeons transplanted a pig heart into one man. And after a 15-year-old suffered cardiac arrest, he's now on a mission to bring AED training to more schools. Welcome back. Lawrence Fawcett needed a new heart, but with a history of health problems, he was rejected by every human transplant institute on the East Coast. So he turned to the University of Maryland School of Medicine, where for the second time ever, surgeons transplanted the heart of a genetically altered pig. Last year, David Bennett received the first pig heart but died 2 months later. Fawcett, a 58-year-old Navy veteran, said he understood the risks. Ahead of the surgery, he said he was willing to try anything for his family. Doctors say they took a lot away from Bennett's xenotransplant and hope to see better results this time around. By genetically modifying animal organs, scientists are trying to trick the human body into accepting the foreign tissue. Each year, more than 2,000 children in the U.S. die of sudden cardiac arrest, but CPR and automated external defibrillators can be life-saving. Bradley Blackburn has the story of one young man who had a very close call and how parents and schools can be prepared with kids back in the classroom and on the field for fall sports.
15-year-old Kanan Dickman was at soccer practice this summer when he lost consciousness. He was in sudden cardiac arrest. He has no memory of what happened, but his mother Pam does. Kanan's teammates and coaches rushed to help, locating an AED and using it within minutes. Automatic external defibrillators, or AEDs, can be life-saving. Data shows they can increase a child's chance of surviving cardiac arrest from 48% to 89%. Dr. Naomi Cortez with Nationwide Children's Hospital says it's critical they're close by and used quickly. Her organization, Project Adam, works with schools and communities nationwide to create heart-safe plans. Just 15 minutes of training can help teachers, coaches, even young students be prepared. A life-saving step that gave Kanan another chance. And a reminder, the device only works if bystanders know how to use it. Bradley Blackburn, CBS News, New York.
And we'll finish with what some call the biggest breakthrough in stroke treatment in decades. Every 40 seconds, someone in the U.S. has a stroke. CBS News chief medical correspondent Dr. John LaPook looks at how mobile stroke units are helping to save lives.
Richard Janelle was on vacation in New York City in 2018 when he suddenly lost strength in his right hand. At age 41, Janelle was having a stroke. Blood flow to his brain was blocked by a clot. But he says if he had to have a stroke, it couldn't have happened in a better place. Janelle was treated by New York Presbyterian's mobile stroke unit. It's a special ambulance equipped with a CAT scan, cameras, and clot-busting medication that allows neurologists like Dr. Saad Mir to diagnose and treat patients remotely. A patient loses almost 2 million neurons in their brain every minute a stroke goes untreated. A study found mobile stroke units were able to deliver medication 36 minutes faster, and patients had better outcomes than with traditional emergency medical treatment. New York Presbyterian's mobile stroke unit is one of just 20 nationwide. Chris Bossert is one of the paramedics who treated Richard Janelle that day, administering the crucial medication. Janelle met up with the team who saved his life a year later at the same bar. And now he's a father. Dr. John LaPook, CBS News, New York.
That's all for this week's Eye on Health. I'm Michael George. Thanks for joining us.